You already know, man. It's Taylor Gang. I die.
Who you with?
Reece.
Yeah. Who you with?
Who you with?
Hey, we back at it, man. Feeling good, feeling great on this Thursday. We a couple of days from Father's Day, so it's really good to have fathers on, especially those that could, help us with our trajectory for the future for our community as well as our families, man. We have a great brother on. We're going to tell you all about it, but first, let's go ahead and play that sound, baby.
It's all about that star power.
Stay tuned because you know Reece is going to have one of your favorite stars with him today.
Stay tuned.
Coming at you live all the way from Maryland, D.C., Virginia area. This is second guest this week from up that way, so we feeling good about that. It must be something up here at the Reec Show. We inviting people from up that way. We appreciate you guys being able to come, but we have someone right here who is helping us learn better about ourselves through genetics. We'll give a warm welcome to Rodney Baylor, Vice President, Client Services of GeneDX. What's going on, my brother?
Hey, Reece, thanks for having me, man. It's all good. Great to be here. Thanks for hosting.
Absolutely. Let's jump right into it, man. You in a field that we don't see many people in. You're our first guest in this genetic discovery field. How in the world did you get into this thing with this field and then with this company?
Well, it's a funny story. It's actually by accident, but I have been in the healthcare industry for about 30 years now. So I've worked with a number of major healthcare companies like Blue Cross Blue Shields and doing the military healthcare program, which is called TRICARE. But I kind of stumbled across this industry and this particular company, and I found it fascinating, the type of work that they were actually doing and how it's advancing healthcare. And it's actually the new evolution as we move into the next century of healthcare, bioscience, genetics testing. And it's something that's actually been around for a while, but just like you mentioned a moment ago, it's very rarely talked about. Or in certain communities, it's actually even underserved and never even shared, because in some cases it's been considered experimental, but in other cases, sometimes doctors and healthcare professionals tend to lean to the more common types of diagnoses and illnesses that folks have. So it's a great industry. I was offered an opportunity to join, and it's a fascinating company.
Man, you said some things there. I've done a few things by accident, like, tripped and fell, but falling into genetic disease discovery. How in the world did that happen? Let's kind of start from there.
So I was working with a major carrier, Blues plan, and like I said, almost 30 years there. And outside of being a clinician, I thought that I knew everything there was about healthcare. But I was sitting home one day and I always get inbox messages from recruiters on LinkedIn, but typically don't, give them any consideration. But this was a particular point or stage in my career where I was looking to make a change. Things have been changing in the current industry, in the current environment. A lot of politics, with the last couple of elections in terms of healthcare and coming out of the Obamacare era. And so a recruiter reached out to me and told me about this particular company, which I had not heard of. And again, being in healthcare, I thought I knew everything there was to know. So once I spoke to him, and he set me up an interview with the hiring chief, then and they told me about the company, and I started doing the research about it. I found that this was something that I wanted to move into and take my career into, because it's a whole nother area of science, and I'm always interested in learning. I'm passionate about healthcare. I've done it for so long. I'm a cancer survivor myself. So this is something that really is near and dear to my heart.
I get that. We have so many people that have been dealing with those types of diseases that could be genetic, especially when it comes to our Black and brown communities. We're really now starting to talk about the health side of things. I've seen so many health seminars and all types of stuff, man. When you talk about heart disease, cancer, certain types of cancers, blood diseases that we don't really talk about, just all types of hereditary and genetic things that we've been predisposed to. And you saying you are a cancer survivor, so I only hit the hype bell for that, man. Congrats on that. Let's talk about that, because I've got people in my family that are dealing with cancer situations or have dealt with hypertension to a point that it may give them a stroke or something. So what you're doing on your side with GeneDX and what that company's doing, are you able to pinpoint family or hereditary diseases?
Absolutely. That's in fact one of the departments we have is called a hereditary cancer team. We have an entire team that focuses on looking at those particular genes and seeing if folks are predisposition, or if they have that. We have a precision oncology department. And we looking at going into the peds environment. We're really trying to get a mandate through Congress to get testing done when children are born, to see if they're, have a DNA panel and a DNA sequence done right at birth to see if they are predispositioned for epilepsy, for cancers,
Okay.
for, particular types of allergies, all types of different diseases that commonly most kids are not treated for. Early on, you typically get your polio shots, or you may get, measles or mumps shots, things of that nature. But most parents, again, in some cases, just simply due to lack of knowledge, lack of education. In other cases, it's a fear because, think about it, as a brand new mom and dad parent, it can be scary trying to get a DNA panel done and finding out that something may be wrong with your child.
Right.
But on the opposite side of that, also what it does is it reduces the odyssey in terms of that family finding out what's going on with their kids. So it's really good. We've had patients that have gone 20, 25, 30 years and not received the proper diagnosis because they've been misdiagnosed. Because
Okay.
doctors didn't want to take the time to necessarily do a DNA panel or DNA sequence. So.
Great information. I just recently talked to one of my best friends in the world, and she was misdiagnosed twice with the situation. And she was saying that the doctor, she finally got to a doctor that was like, let's do a little bit of medical history and a deeper dive into search. And she was like, you're genetically disposed to this thing. And then they were able to pinpoint what she was dealing with and give her a proper diagnosis and treatment plan.
That's wonderful. That's great to hear. And that's what more, individuals need to do. We need to take our healthcare in our own hands and take it very seriously. Many of us basically tend to gravitate to, well, the doctor said this, so I'm going to do that. I was talking to someone last week in Healthcare Awareness Month, and I was saying you'd be surprised at how many individuals go to the doctor, get a prescription, take it to CVS, Rite Aid, Walgreens, get the prescription filled, and just take the medication because the doctor said so, without even reading that little fact sheet that the CVS or Walgreens pharmacy will give you to tell you what kind of side effects are there. How does this medication interact with me? Does it change my moods? Does it change my mental awareness? Many people just don't do that. And, oftentimes folks will go or get misdiagnosed because you'll go in and you'll say the doctor may label something, or he's just autistic or a little bit of AD&D. Give the child a medication and just send them on their way. No, people need to stop and say, let me get a second opinion. Let me get a third opinion. That is your right. Many of us, we have healthcare. And for those who don't, and you may use the state-based systems, you have the right to ask questions. You have the right to insist on, I'm not quite sure about that, before you just want to pop my child with some medication or pop me with some medication. Let's get tested and find out what's going on.
Listen, you giving out golden gems right now, my brother. I so much appreciate you. We sometimes feel that it's an authoritative figure with that doctor. They got those degrees. I'm just going to go blindly with what they suggest. But you're absolutely right. I started reading those labels when I started really listening to those commercials at night. When those medicine commercials, like, it causes this, that, and the third. You may grow a fifth arm and a third eye.
Right.
I was like, hold on, this worse than the disease.
Exactly. And especially if you're being treated with something that's not even the cause of your illness. So you take medicine for 6 months to a year, and that's not even what's wrong.
Yep, absolutely, man. I so much appreciate this information. We got Rodney Baylor, VP of Client Services, and I see why they got you at that Vice President position of Client Services, because you're making me feel comfortable. I want to go get genetic tested right now. Like right now, I want to cut the interview and go.
and you should, absolutely. You don't have to be sick to get a panel. Typically for your insurance to cover it, obviously they're looking for some kind of medical justification or reason to go, because many of the tests, are not cheap. They can be very expensive in nature, but that should not be a deterrent. There's financial assistance plans, there's payment plans, there's self-pay plans, there's insurance. So no one should be deterred from that. But especially when we go back to, again, talking about the kids and the youth, because that's where my passion is as a father myself. If children are missing cognitive stages that they should be at, if they're missing milestones and certain things, or even just us, like you said, black and brown people, we often will make jokes and say, oh, she's crazy, or oh, he's crazy, and joke about things. But really, people could be reaching out or asking for help, and they just don't know how. So again, we shouldn't be afraid to go to doctors. We shouldn't be afraid to ask questions. We shouldn't be afraid to insist on second opinions or third opinions. And absolutely, to your point, Reece, go out and just get a DNA panel, get a DNA sequence yourself, and find out, are you good? Is there anything that you can work on? Change your diet, change your mentality. Maybe you do need a certain medication if possible, or maybe you're just great and you're healthy and you living life and enjoying it.
I love that information. Let's say we do go get a DNA test, a genetic test, right? And you guys dive into what's going on with us and see certain things. Are we able to get preventative? Let's just say we find, okay, you may develop cancer based on what we see. Are you able to develop a almost like a early treatment plan to do things to prevent it from happening?
Absolutely. Depends on what the illness is. You're absolutely right. You can start changing things like your diet, exercise more. That can help with certain things. Technology, there's a lot of studies that show, a lot of people today on their phones constantly, on laptops, especially with COVID hitting the world and people working remotely. But you can do things to avoid it, like sitting laptops on your laps, especially for men, because the radiation coming from the laptops and so forth can impact men, in their genital areas. And you certainly don't want, things like that to happen. The phones, we need to give ourselves we give it. No, you don't want that to happen.
Let me move this phone over real quick. Let me make some space.
Exactly. Give yourselves a break from the phones. We're constantly on our phones. If you can use earpieces and so forth instead of having the phone up to your face, or use your speakerphone when it's available, but disconnect from that technology. And that's just one thing. But certainly, again, going back to your question, changing your diet, exercise, maybe a certain particular medication can start to keep the illness or whatever the diagnosis is at bay, or keep it calm. But that's the whole point, is getting early detection, getting a treatment plan, whatever that plan is, early, to either keep it at bay, prevent it altogether, but it shortens that odyssey. And maybe it's something that you also need a support system with. There are certain support groups. We have many families who have young children and they're going through this because they're first-time parents. There are all kinds of community-based support groups and organizations that are out there for individuals who may need help with dealing with this particular situation, whatever it may be.
Let's magnify the two things on the youth side of things, because I know you say you're very passionate about that, and I can absolutely tell. One, parents that are in the hospital just having a new baby, are there any negative things that could come along with getting genetic testing done? And I don't mean the diagnosis. I just mean, is it painful for the baby, stuff like that? And then I want you to reiterate on the cost side, because there are ways to offset it.
Absolutely. So no, genetic testing is not painful at all. The most common ways of collecting DNA is what we call either venipuncture, which is basically you're drawing blood from the human body, or a buccal swab. And a buccal swab is nothing more than swabbing the inside of your mouth and collecting DNA. So, and for children, obviously that's a more preferred approach than, having to do the venipuncture and sticking them with a needle and drawing. So it's not painful at all. A couple of swabs of your inside of your mouth or blood, and we can run all kinds of DNA sequencing and panels on you. And that DNA samples we keep, based on what the patient has provided. We can run samples if mom and dad have one baby now, and then 3-4 years from now have another child. We have their DNA already on file. All we need to do is collect the DNA from the new child, and we can run a panel for the entire family. And what's important too, is it's called a trio. So you want to do the entire family whenever possible, because mom, dad both have their own lineages that they come from, and now they've come together and they have this child. So it's better cases to do a trio, which is mom, dad, and child. But when that's not possible, maybe mom's not in the picture or dad's not in the picture, then you do the child and whatever parent is available. But it's not painful at all. Now, going to your second question about the financial side of it, most insurance companies today now are covering genetics testing. And there's a lot of legislation that's being pushed, again, as I mentioned earlier on, to try to get testing done at birth. but it can be done through insurance companies for those that have it. Typically, it does require some kind of medical diagnosis or medical reason that you're doing the genetic testing, but it is commonly covered. Secondly, from there, most labs like ours offer financial assistance either through a payment plan where we can set up, and break it down in incremental payments. There's self-pay pricing for those individuals that maybe insurance doesn't cover it. So there's a number of different options that are available, which again should not act as a deterrent for folks not to get tested.
Great information. Another question when it comes down to kids, you mentioned some behavior issues may come about, and it may be linked to genetics.
Yes, absolutely. We've had a number of patients and studies that have been done where kids have missed specific cognitive milestones like walking at the common times, talking, their computation and just collectively alphabets and numbers and things of that nature. And oftentimes we miss, parents may miss those signs. They think that, okay, maybe he's just a little slower or she's just a little slower. Those are things that as parents we should be paying attention to specifically. And if children are missing those cognitive things, take the child to be seen. Don't let the doctor just automatically label though the child with autism or with ADD. No, insist on, let's get a DNA test. Let's get a panel done to see if there's something deeper. Maybe it will come back that the child does have autism or Down syndrome or epilepsy or whatever. And that way you can get the appropriate diagnosis because you run that DNA sequence, not just looking at something on the surface. Because your point is valid earlier. We look at doctors from an authoritative standpoint, and this is not to bash healthcare professionals.
Right.
We need them. But yeah, they have master's degrees and PhDs and all of that. But guess what? They're human, just like us. And mistakes can happen. Misdiagnoses can happen. So you're the one that's in control. They may have the degree and they may be the subject matter expert because they went to school, but you're the consumer, you're the parent, you're the one that's in control. So insist on getting tested.
That's some exciting stuff, especially when it comes down to behavior and some, like you said, they just go in and say, okay, oh, your child's got ADHD. Well, no, let's get a genetic test and see where that lies. And it's like a blueprint inside of your blood, right?
You got it. You said it. That's perfect. It's like a blueprint. It's a blueprint to the human genome and the exomes, which is what gives us all of that rich information. And, absent information, you make assumptions. Don't make assumptions. Let's get the data and say what the science says.
I really appreciate how the science can work along with the healthcare physician, and then you could come up with a real plan for the betterment of your whole family and change the trajectory of a lineage of people.
Absolutely. Because if that child has it and you can again start that odyssey early to give that child a better quality of life, as opposed to just misdiagnosing or ignoring it or skipping it. And then later on, you're in a much deeper situation or you're having to deal with things in a harder stage. And then it also can help you plan the rest of your family. If you want to have additional children or different things or, so forth. So it's good. It's just like going and getting preventative treatment, getting a checkup, men getting their prostates checked, women doing mammograms, pap smears. It's all part of prevention.
Makes a lot of sense to me, man. I appreciate your time. I want to ask this: what are some of the common things found in our Black and brown communities when it comes down to getting this genetic testing done? Some of the things that you've seen a lot.
What I find is that me being African American in this community, there's not a lot of us in this community, in this particular field of science and healthcare. What I find is that a lot of the patients that come are either middle class, upper middle class, or affluent patients who will go get tested because maybe their doctors are a little bit more savvy in the communities that they're going to. Often find that in Black and brown communities, this is not something that's sought after because there's not a lot of knowledge about it, which is why I appreciate you having me here today and some of the other outlets that I've been a part of, is to raise the awareness, to bring this much needed information into those communities and say, ask for testing, do the research, check into it, because it's not often talked about. It's not often, it's not a common thing that people hear about. And again, many doctors don't just come out, initially offering genetic testing. They will just give an initial diagnosis based on history, their education, what they've seen in clinical trials and studies. But it is something that's very much need to be raised in the communities.
Absolutely. Now, when I think of genetic testing before this conversation, I always just thought about 23andMe. I'm trying to find out if I'm 17% Nigerian or Egyptian or what's going on. But
right
now that I know that these things, which that is important too, but
yeah.
now that I understand more, and because of your knowledge of the subject, man, it's making me want to go do it and take my children to go do it as well, so we can find out, things that may happen in the future, may not happen, or where we come from genetically.
Exactly. That's what it is. To your point, 23andMe, Ancestry.com, people just look at it from, DNA, just thinking, okay, it's just fun. Or you see it on CSI and they're using DNA to try to solve a crime or something. But, it's so many more facets and aspects to it. Obviously, again, prevention, diagnosing illnesses and conditions now. And that's a great thing to do. Yeah, go get DNA tested. I, as an employee myself, have the option to do it. And prior to working at this company, I had never thought about getting DNA tested myself. But having been a cancer survivor now, I have a son who's 26 years old. He's thriving. He's healthy. He hasn't had any medical conditions, thankfully, so far over the course of his life. But if this was something that I had known about years ago, or maybe when he was initially born, having been a survivor myself, I definitely would have gotten him tested right away.
Right.
Certainly still too late now, but I'm just saying, again, it's the lack of knowledge. It's the lack of raising it and talking about it in communities, for people of color and minorities, where either, again, there's the financial means may not be there, the particular healthcare systems may not be there, or in some cases, just lack of education on us as a consumer. Again, we have to take responsibility for our own health. We get one body, we get one life. We need to cherish it and respect it.
That'll be our quote for today, so I won't have to do a Pops Knows Best or Reach Peace of Mind. One body, one life, so respect it, and respect comes in the form of action at all times. So thank you for that. You just made my job easier. All right, let's get into the fast forward, because I need you to get back out here to this community and spreading that good word. I very much appreciate it, man. Thank you for all the information, but we're going to play a little game called Fast Forward. I'm going to hit you with some questions. You just answer them any way you want to, all right?
All right, let's go.
All right, question number one, man, because you mentioned this and you just mentioned your son, man. What's the best part about fatherhood for you?
Looking at my son every day. In fact, we're away right now, and just looking at him and just being proud of everything that he's accomplished is one of the best feelings in the world, being a parent.
Absolutely. Number two, how has your job changed the trajectory of your community and your family?
It gives me joy, being able to help other people. There's a video that I play for all of my staff, and I require every new hire employee to come through it. It's through the Cleveland Clinic. It's called the Empathy Video. It's about 4 minutes long. There are no words spoken. And I guarantee you, every time I show that video, people cry in the room, because what it does is it's real patients, and it has captions over each one of them as it goes through the video. And it's talking about their journey for whatever their healthcare issue is. There's somebody in the video where they just signed a DNR, do not resuscitate. There's one video where a man just found out he has cancer. It's a number of people like that, but it reminds the staff in client services of why we're here. We're here to act as champions for people who are going through some kind of illness, some kind of odyssey, some kind of search for a diagnosis, some kind of treatment, and they're looking to us to help them with that journey. I tell my staff all the time, we're not an Amazon, we're not Microsoft. People are not calling to order things from us. People are calling us because they're in need of something. They're hurting, their family members are hurting, and the fact that we're in a position that we can help them through that odyssey, through that journey, give them some kind of relief or support, that's the joy that gives me in doing what I do and helping the community.
I'm glad I asked that question. That's the answer we all needed but didn't know we did.
Yeah. Long answer, but that's my answer.
I like it. I would love to see that video too. I hope we can share it, and we can share it with some of our listeners and watchers.
Absolutely happy to.
Okay, all right. Question number 3. What is the most unlikely thing that you've learned that you could find out through genetic testing?
Wow. probably, I think, just there's so much that you can learn about the body and the number of DNA panels, and see, it's so fascinating. And even to this day, I've been with the company a little over a year, and I'm still learning. Operations is my area of expertise, but the science side of it is just so fascinating when you sit there and you look at all of the chromosomes and the genomes, exomes, you do all the testing. It's just fascinating what you can find. It's almost unlimited, from a science perspective. So when I look at the people behind the scenes, and when I go to the office and I look at our lab and I look at all the machines and everything that's happening, it's just fascinating to learn. And I'm still learning. So to be continued on that question, but there's a lot to know.
That's awesome. It sounds like you have a wonderful purpose and focus on what you're doing, and that's definitely commendable, man. Last question, and I think I know this answer. What's one piece of advice you would give yourself at 18, right before you really hit this world?
Wow, at 18, if I was when I was 18, if I could tell myself,
Oh yeah, definitely.
wow, live life, enjoy it, ask questions, be respectful, and just be good to people. That's it.
That's it. I love that. Good answer.
Come
Let me
back
hit the
to
hype
you.
bell for that. Hey, man, Rodney Baylor just came in. GeneDX, we appreciate you for coming by. Can you give the website where people can check you out, can check out the company if they want to get genetic testing? Can they do it if they're not in Maryland? Can they do it out of state?
Absolutely. We're across the country. So it's GeneDX.com is our website, www.gene, Gene, and the letters DX all together, GeneDX.com. We've recently merged with a company called Semaphore, SEMA, and the number 4 to become even a bigger powerhouse to, again, help folks with hereditary cancer, women's health and oncology. We focus on children and peds and coming into the NICU, which is a newborn intensive care units, continue with the genetic testing and all of that. So we're a grand organization with a plethora of services that we can provide to individuals. You can find me on LinkedIn, Rodney Baylor. And I'm just here. I'm here to happy, and I'm so privileged and pleased to be able to join your show today, and be able to talk to folks about it.
Well, thanks again. We appreciate it. I'm not a stranger to Nick. You had a preemie baby, 88 days, and I was there every day, so I totally understand. So we definitely appreciate what you guys are doing to help that arm of it. Very good people down in almost every hospital in the world that are in the NICU, so thank you again, man. Thank you for helping me with my job once again, because our Reach Peace of Mind today is something that you said. One body, one life, one time to use it the right way, so respect it. So we definitely going to keep that going. So we appreciate you, man. Thanks.
Thank you so much, Reece, for having me. I appreciate it.
Absolutely. All right, you guys, get ready. We're about to tune all the way in, all the way live, baby. We're going with this mix right here on Reach Radio on the streaming side. We appreciate you guys tuning in. And tomorrow is the last day to win tickets for that Buzz Lightyear, the movie. It's coming out. I want to see it. I want to take the kids to see it. That's my excuse to go. I'm not going to lie to you. That's my excuse to go. And I know some parents out there feel the same way. So get ready. Tune in on our social media side at Reece Radio, REEC RADIO. And, of course, at Reece Sweeney on my personal page, REEC SWINEY. I love you guys. We'll be back tomorrow. Another special guest right here at 12 noon. Reece Show.